It is June 18th. We're here with Humboldt County Health Officer Dr. Teresa Frankovich.
Hi.
And there's been some new developments in regards to COVID and different guidances for the state of California. So we'd like to talk to you about that today. But first, can you just give us an overview of what we're seeing case-wise COVID-19 for Humboldt County and for our surrounding areas?
Sure. So again, we monitor continuously the activity of COVID in our community, and certainly keep an eye on surrounding communities as well. I'm sure a lot of people have been watching the national stage with some states who are struggling right now with increasing case counts and concerns. Certainly, even when we look at the state of California, I've been asked about whether we are going to have like a second surge of cases. And I just really want to point out that we have not had our first surge completed at this point. So when we look even at the state level, if you pull up their data, you can see that California has just been on an upward incline. We have not done this. We've been increasing, and we are continuing to increase. And so we are really in the first throes of this, even though it feels like it's been a long time. Locally, we've been able to avoid large numbers of cases and currently stand at 108 positive cases in our community with 13 hospitalizations and 4 deaths. And so, at this time, the message in our community, I think, is that, again, we have relatively low levels of circulating virus as far as we can tell from our testing. The percent of our tests that come back positive is pretty low right now, and that's really good. Again, the more testing we do, the more robust our testing, the better sense we have of whether that's an accurate number. And so we do encourage people to be tested. But right now, our numbers look pretty good. But we are looking at these as we move forward in the context of all the things that we're doing and opening up in our community and all of the events that have been going on in terms of, for instance, protests, holidays, upcoming holidays. And we know that a lot of these instances are things where we can see some increased spread. We talk about 2 weeks being a good period to watch after those events, and that's a good period to look at. But what we know about COVID is it's rather sneaky, and oftentimes it really it sort of smolders in a community. It exists at low levels until suddenly it increases significantly. And so that's why I don't want people to have a false sense of security that we are going to sail through without more cases or significant issues with COVID. Everything suggests that we will see more cases going forward. Our goal is not to have no cases. Our goal is to have a manageable number of cases. So all of the pieces we put in place for prevention are increasingly important as we move forward. When we were all staying primarily at home, it was helpful for the little bit that we were out and about, but the more we are throwing people together and intersecting in the same public spaces, even though we're masking and social distancing and all that, the more chance there is of transmission. So again, I just want to emphasize to people that, we're not through this. Really, COVID lies ahead in terms of our exposure in this community. And I think that we need to just adhere to all of those safety precautions we've been talking about as we move forward. Which sort of brings us to the news from the state today, which is the state of California today issued a masking mandate for residents in California. And that was just released late this morning. So we are looking at that masking. They're, of course, citing the fact that, and I believe the governor in some comments also cited the fact that they're concerned. They're concerned about the increasing number of cases they're seeing in some areas of the state. They're concerned because we're opening things up across the state, and they're not seeing a lot of masking in some areas. And there is increasing scientific evidence that masking, when used with social distancing and all the other things we've talked about, is a really good, helpful tool to prevent spread. And so I think the state is basically putting an emphasis on that in issuing this mandate for masking. So overall, it really is the idea of masking when in public spaces, obviously not at home with your household units, out in public spaces, in the outdoors when you cannot socially distance. If you're able to socially distance outside, then that is not required. But then in other spaces that we share, sort of in restaurants, other than when you're eating, when you're in, retail businesses and other spaces, we want people to mask. Their guidance is a little bit different than ours, I think, on a couple points that we can see right off the bat. One is that the masking age for children is the order states children under 2 should not be masked, which we had in ours. But it really doesn't, in our order, we had it being not required for children under 12. That is not in the state order. So clearly they're encouraging masking for children under 12 down to the age of 2. And actually the language in our own order said that as well. While it was not required, it was strongly encouraged. So the state is a little more emphatic on that point. And then we'll parse out the rest of the language on here to see how it aligns with ours. But I think the messaging here is that there's increasing confidence in the idea that masking is a helpful tool. And at this point, if we want to protect each other from illness, masking, social distancing, washing, all of those things are the tools we have to help keep each other safe. So we're really encouraging the public and asking for everyone to sort of take care of their neighbor by doing this.